There's just so much more to hear.
Download our podcasts at DubaiI1038.com.
It's Testicular Cancer Awareness Month. We're talking about one of the most common cancers in young men. We're really lucky to be joined by two of the leading oncologists in the region. I've got Dr. Sadir Al-Wadi here. He's the Director of Surgical Oncology Services at Al Zahra Hospital in Dubai. And Dr. Dima Abduljabbar, Medical Oncology Specialist based at the Advanced Care Oncology Centre in Dubai as well. Good afternoon, guys.
Good afternoon.
How are you?
Lovely to have you here. I know you're very, very busy people, and we do appreciate your time. And you are here, of course, to answer any questions that people might have around oncology, and specifically around testicular cancer this afternoon. 4001 if you've got any questions or concerns that our experts can help you with. So, Dr. Dima, tell me a bit about yourself. What drew you to working in oncology?
Actually, my dream was to help Arabic people. Since I started my oncology career, is to help Arabic people to kind of know more about cancer, because all of Arabic kind of specifically, they try to hide their eyes and they don't want to see the truth, that they have to do all these screening things and examination. They don't want to know even if they have cancer. So I wanted to educate more of our population to have more awareness about how treatment can be easy and curable, so patient can have really lifelong, disease-free, which we say like curable diseases. So even with like late stages, we still can have curable disease, and that's my goal. Hopefully,
So trying to kind of take away the stigma and the fear, open eyes.
Correct.
And as you say, a lot of the conditions that you deal with are highly treatable and curable as well. But often the fear factor can get in the way of people even seeking treatment in the first place, or even acknowledging that there is a problem to deal with.
Correct.
And what kind of cancers are you specialising in, or are you working with?
So actually, I do work with all kind of solid tumor cancer as well as the hematological malignancy, but mainly breast is my interest piece.
Yeah. Okay, so we're also joined, hello sir, how are you?
How are you?
Dr. Sadir is here, Director of Surgical Oncology Services at Al Zahra Hospital in Dubai, and I love that he's here in his doctor's outfit.
Thank you.
And you're bang on brand with Dubai Eye colours as well. So tell us, Doctor, what's happening at the clinic at the moment? You're busy. What kind of patients are coming in to seek help at the moment?
It's really all subspecialties of the solid cancers, and we also
solid
have
cancer.
Solid cancers.
What does that mean?
Solid cancer is different from the hematological, which is non-solid type of cancers. But here we are talking about like American differentiation between hematology oncology versus other tumors, which is the solid cancer. That's why Dr. Dima is really more focusing on that part. From the hematological point of view, from the surgical point of view, the American training of the surgical oncology is different from the European training. The American training is all have the subspecialties, including all different type of cancer in one person, including the head and neck, like foregut, hepatobiliary, pancreatic, and the colorectal, including sarcoma, melanoma, and also the breast.
Wow. So lots and everything.
Yeah.
And it must be a very rewarding job in many ways, but what Dr. Dima is the most challenging part of your role on a daily basis?
Well, I think convincing the patient about the importance of treatment, because even if the patient comes in to your office, it doesn't mean they can go ahead with the treatment that you're planning for them. They think that they have this herbal, or they have this prayers, or they have, or we're kind of trying to investing in them and just get money out of them. This is the main message we want to get to everybody. I tell them, you don't have to get treated with me, just get treated anywhere. You can get a second opinion. You can go to US for a second, or UK, or Germany, but you have to get treated. There is nothing like prayers or herbs that can help you without getting treatment, the surgery or the chemotherapy.
So that's the big obstacle, is getting that message across. What about you, Dr. Steer?
We do most of the cancers. The message, the problem here, it is that people are really not sure who's the best doctor.
Okay.
So second opinion is going on for long term about it. We try to, in our center, to get the free second opinion for the patient.
Okay.
Free second opinion is very important, just to satisfy the patient, make him assure that he is on the right track without having any bad effect or delaying of the treatment.
So it's about getting that peace of mind and making sure that they've had all of their questions answered, really, before they can feel equipped emotionally and with the information to make decisions moving forward. We're here with questions to be answered. If you want to get your question in, do get in touch. Or take a message in saying, asking about testicular cancer. Is this type of cancer hereditary, Dr. Dima?
Well, it can be related. So risk factor can include any family history of of testicular carcinoma. It can be history of undescended testes in the past.
So if there's been undescended testicles, that can be not necessarily a red flag, but something that you need to be mindful of.
You need to kind of check yourself all the time and make sure you don't have any abnormality. And also, it could be out of nowhere. You could not have any family history or anybody in the family with cancer. You could just present with cancer. It can be a mutation or something that's going on.
Okay. And Dr. Sadir, who generally gets this kind of cancer in terms of age groups or nationalities, cultures?
There is no difference in any age group or nationalities. The most important part is young adult, that they are the most having these type of disease or these type of cancers. The problem, as Dr. Dima said, the undescended testicle and exposure to more temperature for the germ cells of the testicles make them more pre-exposed to have higher level of cancer. But that doesn't mean anyone who have undescended or poorly descended testicles or surgery after undescended testicle, they are really will have the cancer. They are more probably to have such a thing.
Okay.
Other factors, genetic, as we said, radiation exposure and environmental factor might play part in that one.
What kind of environmental factors should people be mindful of?
Exposure to radiation and multiple trauma to testicle.
Really? So a trauma can then lead on to
Definitely.
a cancer?
Definitely.
Wow.
Recurrent trauma and recurrent... The way in America, the chimney workers, they are really have a higher incidence of scrotal and testicular tumor because of the continuous friction and damage to the testicles and the scrotum.
Wow. And when can it be found early? I think that's probably a question a lot of people have when it comes to cancers. At what stage can people start examining?
Sorry, you said what stage?
When can it be? At what stage should you really start examining? Can it be found early?
Yeah, actually. So testicular cancer is divided, unlike other solid tumor cancer, into 3 stages only instead of 4 stages. So stage 1, when it's basically just in the testicle, when you can just feel it, but it's not gone anywhere else. Stage 2, when it's gone to the lymph node, and stage 3, when it's more advanced to the lung and everywhere. So our goal is to have it as early as stage 1, when it's only to the testicle, when we will remove it and maybe no further treatment is needed, maybe, depend on the type of the tumor. But so that's why we're trying to get people aware that if there is any abnormality they feel, usually it presented as a painless mass, just like a small thing that you can feel unusual to you by the person or his sexual partner, but usually very rarely presented with pain. You know, just 10% of them present with pain or heaviness. Usually is just painless mass.
Okay. And at what age should men start examining themselves, Dr. Sadir?
There is no specific age to what time exam. The point here, it is like the women breast examination once monthly or once every few months. That will be part of the daily activities.
And from kind of teenage?
It can be at any age. That is just a matter of evaluation of your body. Like you evaluate your skin, evaluate your body, evaluate your...
But so many people don't. You know, this is the statistics I keep on coming back to again and again, is 70% of men do not self-examine.
I think it is more of ignorance to that part. As we now getting to the level that breast cancer is a curable, testicular tumor is really curable if you decide it and find it early and treat it early. And the survival of the testicular tumor is much, much higher than the breast cancer. We really embark on cancer screening. What we have really forgot that part of any simple screening or even the brochures that really looking for screening or evaluation. We go back to the same. The incidence is much, much lower than the breast cancer.
Rory asks, my father died of testicular cancer when I was a child, and I've always been scared of the disease. I'm now in my late 40s and wondered what type of risk there is at this age, as I've heard it usually affects younger men.
Definitely there is a risk for the son if the father have testicular cancer. But the simple screening and the simple testing done, usually as in the women, 10 years before their first degree relative, she should have an ultrasound. And if there is nothing in the ultrasound, you should repeat it every 5 to 10 years. Because the half-life of this cancer is not very fast. And in addition, the picking up by ultrasound or even by simple clinical examination. The way we compare the testicular cancer in the male, it should be like ovarian cancer in the woman. Unfortunately, ovarian cancer has become late in the women because it's hidden, while this one is very easy exposed, that we can find it even by simple clinical examination.
So why do you think men are not examining themselves? Do you think it's, as you say, lack of awareness around it, or do you think there might be a little embarrassment factor as well?
It can be combined, honestly combined.
As we said, it's Testicular Cancer Awareness Month. There's a big push. Obviously, there's the Movember, a huge initiative that takes place every November to raise awareness around that. And they've put together a little bit of a jaunty video, which I wanted to share. Here's some advice from the Movember Testicular Cancer Awareness campaign called Know Thy Nuts.
Your nuts. We know you see them regularly, but how well do you really know these two? Most of us don't really know our nuts at all. In fact, 70% of men either never have or don't regularly check their nuts. Why is it important to know thy nuts? Because for young men around the world, testicular cancer is one of the most common forms of cancer. That's why we're asking men to give their nuts the recognition they deserve. Get to know what feels normal and head to a doctor if something feels irregular. It's time to give your nuts a voice. Because knowing your nuts might just save your life. Know thy nuts. Movember, changing the face of men's health.
Gentlemen, know thy nuts. When we come back on Dubai Today, we're going to be teaching you how to self-examine those testicles. We've got Harry on the line now. Good afternoon, Harry.
Good afternoon, Helen. How are you getting on?
I'm well, thanks. How are you, more
Good.
to the point?
Very well. Living the dream.
Are you? Living the Dubai dream. Thank you for coming on the show this afternoon. I understand that you've undergone treatment for testicular cancer. How recently was it, Harry?
I finished about 2.5 years ago.
And
it was very much going through the process of all the chemo when that finished, and then hopefully, touch wood all the time, you'll clear after that.
Hope it'll clear off. So were you in Dubai when you discovered it, and how did you discover
Yeah.
it?
I discovered it by having very severe back pain, weirdly.
Really?
And subsequently I found out that's quite a common sign, but of people with all sorts of cancers. And so for about 3 weekends in a row, I got chronic back pain, and I went to see my GP, and they gave me an injection, put me on a drip, and sort of calmed it down, and they thought it put it down to a gallstone blocking a hole to start with.
Okay.
Anyway, it just wasn't going away, so I was sent off to the Advanced Radiology Centre, where they scanned me looking to see if this gallstone was blocking a pipe or something, and they actually spotted cancer in my lymph nodes.
So it had gone from testicles into lymph nodes. So would that be about?
Yeah.
So we're joined by Dr. Dima and Dr. Steer here on the phone. So Dr. Dima, as you said earlier, that'd be around kind of stage 2, as you explained
most likely. And there is also something called risk stratification, is when we stratify patient as good risk, intermediate, and poor risk, depending on the type of the cancer. So, Harry, hi again.
Hi. Hi.
I just wanted to check what type exactly was it?
It was a classic Simona, and it had got to stage 3 actually.
Oh, okay.
At the time I was diagnosed as
So
such.
just seminoma, right?
Yeah, seminoma.
Okay, so that's usually one of the good types that usually only good and intermediate, they don't carry to the poor risk. So even if they are advanced, they still considered as intermediate risk.
I like this kind of the good cancer. You know, it's a funny term, isn't it?
I mean, even
the doctor was delighted when it was that.
Great.
Because you've got a 95% cure if it's that.
Well, those numbers are absolutely what you want to be hearing. But what was getting that diagnosis? Like, you go in, was it an MRI, Harry, that you had, or kind of
and then he called me back to be more, because this was looking at a different part of your body than obviously where it started. Mm-hmm. And so he said they called me back, and they actually didn't get me, tell me what they were looking at again. I was fairly bad-tempered about having to go and do it again, but thankfully went through it. And then obviously they told me that I had a problem, and so went home and had to explain to my wife this was going on, and she obviously got much more stressed than I did. And well, then we went to find out what was going on, and actually then we got into the process. First of all, they obviously did an examination and found it on my testicle, and then it gets examined, and then they remove one, In my case, sometimes it's both, if you're unlucky. And then I actually went to London. A friend of mine from school put me in touch with a doctor in London, and I had my treatment in London.
So it was a diagnosis here, the Cromwell.
Yeah.
Dr. Steer, you had a question for Harry?
So Harry, this is Dr. Rai, I'm the surgeon. I just want to get more details about, so you have the diagnosis by removing of the orchidectomy, your testicles from the groin completely, right?
Yeah, I mean, there was a diagnosis because they actually could feel it.
Yeah.
Now, in hindsight, I probably could feel it, but being a man, you don't go to the doctor.
Yep, isn't that the truth?
and secondly, I actually didn't think it, at the time, it's anything to worry about. I think afterwards, I probably should have questioned it, but also trying to remember what happened before the diagnosis.
Yeah, that's what question.
Your memory can be clouded.
Yeah. Did you have that mass for how long before your diagnosis? Because this is very initiative to the other people to get awareness. Especially we have this month is awareness of testicular tumor.
Yeah.
How many months before that your surgery you have that mass?
Well, I had the back pain for about 3 weeks, 4 weeks before, and that was my real symptom that got me aware that there was something really quite wrong. Now, the actual growth on my testicle could have been there for a year before, for all I know. I felt something there, but I never really thought it was a problem.
That's the most important thing here. It's a message to everybody and who hearing us. Whenever you have any abnormality in your testicle, it is very simple test. You go and have to your doctor, ask about anything, and he will examine you. And the most likely simple thing is to do an ultrasound. So ultrasound is like a breast ultrasound. It's just a simple test. Will not take more than 10 minutes. Check your testicle, this one, check the other one, check the accessories of the testicle and the spermatic cord, and just give us some information more detailed about it. So when it reached going to the back pain, it means either the lymph node get involved or the bone metastatic to that areas, which is give you more advanced stage than what you have in the beginning, which we can avoid it a year before your diagnosis. We don't make you feel guilty about it, but just we try to get the benefit of the story in order to make it really rounded up for the future for anyone who are hearing us to get more awareness of testicular cancer. Let's go back to the second stage. Or second question.
I would totally agree with that.
Yeah.
And probably my ignorance caused not.
No. It is not just. We are really sometimes overconfident in handling things, which is we need just to get simple opinion. That's what the best way to do it. It's often
in so many things, you see what you want to see, you believe what you want to see, and you think it can be other people's problems, and whereas it can be very, it can all there be at home. So what was your treatment? What did it involve, Harry?
Well, obviously I did the ultrasound first to check, take it to the next stage. They do when you're being diagnosed, obviously there's quite a lot of feeling that goes on, and then you're then given an ultrasound. Once they're happy with that, then you have it off. And then I started a course of 4 rounds of chemotherapy.
Mm-hmm. Did you get the BEP?
Sorry?
Did you get the BEP regimen?
God, I don't know.
Not sure.
You don't remember?
Sure.
Okay. Was it 4 cycles?
It was 4 cycles. I think it was something similar. I would take about 3 days to do the first 3 cycles when I was drinking water furiously all day.
Yeah. And what was going through the chemo like, Harry? How did you find it? Because it can be such an individual experience. My dad had chemo and was absolutely fine. I've seen people completely floored by it. It's such an individual experience, isn't it?
The momentum catches up with you with it. The first one, you think, okay, what's chemotherapy? Then your hair starts falling out. And I think when your hair falls out, that's the sort of the moment that you feel that you've got cancer. And everybody around you knows that.
Start to feel pretty real.
And that makes it sort of much more real. I'm probably not bright enough at that to really realise what was going on until that stage. But then at that point, you walk into a room and you've got a bald head. Everybody thinks, "Wow, you had a lot of hair last week." But as I went through it, you get more tired as you go because they hit you hard.
Yeah, and that was all in London, and then you came back to Dubai.
I had top up here.
You had a top up.
I'd have 3 or 4 days, and then I'd get over it for 3 or 4 days, come back and do a bit of work, and then I'd have one there would be 2 interim top-ups, which would take a couple of hours.
And how has your health been since finishing treatment, Harry? How have you been feeling?
My. Well, do you know what? Because they look into every part of your life when you're ill. I'm now
feeling
having to correct other things. So other things emerge, which is probably a good thing in the long run. So, but touch wood, my health is fine at this moment, and we keep firing. And actually, it's when you're going through the process. I know it's not perfect, but if you've been diagnosed and been told you've got a 95% chance, you realize you've just sort of got to get on with it.
And how was it with the family, Harry? How did they cope with the treatment as well?
Well, we had a young son, and obviously it's quite stressful to start with, and it's a little bit terrifying. But I didn't ever want him near the hospital because I just don't think it's very good. I didn't think it was very good for him to be in a cancer ward. Mm-hmm. They're not particularly pleasant places, and although we were lucky sort of having a room and things, but my wife would come and visit when I was doing it. She was actually in the UK for the summer, and I would come back and forth. I probably became, quite sort of selfish because you put your head down and you're just trying to get through it yourself. Mm-hmm. But obviously these things are testing.
Absolutely, and
have to come out the other side at some point.
And you have very much come out the other side, and a very positive and optimistic outlook for the future in terms of both your attitude and the health that you have. So congratulations on
you have to be positive whenever these things happen. There's it's obviously a bit of a shock to you at the time, but the doctors now are so amazing at treating you. I mean, as I understand it, if you had any of these things in the 80s, if you survived the chemo, you survived the cancer. Mm-hmm. Now they're so targeted that it's fabulous.
Harry, thank you so much for coming on and sharing your story, and as we said, really raising awareness around something that so many men need to be more educated about, and for doing your bit. An absolute star. Have a great afternoon.
And you.
Cheers, fella.
Thanks a lot.
Cheers. Bye.
Thank you, Harry.
Thank you, Doc. Thank you.
We are joined this afternoon by Dr. Sadir Alawadi, who is here from Al Zahra Hospital. He's the Director of Surgical Oncology Services. And Dr. Dima Abduljabbar is here, Medical Oncology Specialist, and she's based at the Advanced Care Oncology Centre here in Dubai. Thanks again to Harry for joining us earlier. Some great messages of support coming in. One saying, very brave of Harry to talk on air. God bless. Really do appreciate you telling your story, Harry. A question here from Sachin. He says, I find it really difficult to check myself for testicular cancer as I feel there are small lumps that have always been there. I'm in my early 30s. Should I be scared? Do I need to see a specialist, or are these normal? Dr. Sadir?
Having really lumps in the testicle is really not very common. However, the lump size and the examination of the lump should give you more information about the nature of that mass or the lump in the testicle. But any new lump that it is increasing in size or causing some discomfort or causing pain, in addition to any other associated symptoms, temperature or any other urine problem, should raise the flag that you need to see your primary care.
And when you say that, I think if people to find a lump and suddenly think, I need to go to a cancer doctor.
No.
People can go to their family medicine doctor, their GP.
We don't make it here advertisement to come to us. We make it really an educational part to go to the proper channel. Primary care doctor can fix 90% of your issues. Once we go to the preliminary diagnosis of there is a lump in the testicle, abnormality, then our job is to sit with you with eye contact to explain to you what is the next step. We don't need to frighten the listener now that any lump you should go immediately to a cancer doctor.
Okay. Now, we have given you 2 red balls, Dr. Sadir. And what I want you to really explain in great detail is how people can be self-examining. So if you could speak to our gentlemen listeners, how can they examine themselves at home on a regular basis? Thank
you, Helen. The point here of self-examination of the testicle is the same like breast self-examination of the woman. Any woman after puberty should have once monthly self-examination. However, the data about that not very clear, that it's improved in survival or improved in early diagnostic. But it is a simpler, reassuring methodology that can help any patient for self-satisfaction and in order to detect things or he's doing something, participate in his diagnosis and his treatment. So, doing the self-examination by the age of puberty of the testicle is a simple test. You have to really do like this ball. The testicle is made of three parts, which need to be aware of it. Proper testicle, which is the rounded part, which is oval shaped somewhat, which is they have the size, it is different from one person to another. Essentially, it's about 3 to 4 centimeter in size. But if you have a bigger one or smaller one, doesn't mean that you have a tumor. It is mean that differentiation in the size depend on the age and the gender and the entity of that person. It should have a firm consistency, that it's not hard and it's not really very soft. It is like firm in nature, and that's the very simple thing is touching it causes some discomfort or pain. If you have more than expected discomfort or pain, there are some issues in it, either because of some inflammation or underlying problem. But that should not raise that you're having a cancer or anything. So we have the upper pole and the lower pole should be examined properly. For your left testicle, you get examined by your right hand to be sure that the testicle shape, surface, contour, and it is within normal shape, within normal limit. Do not have any bumps or lumps. Do not have any hard masses, or do not have any area of induration or any underlying structures that could be bleeding or causing a pressure on any other part. That is very simple. Any suspicious of any of that area should raise the suspicion to go and visit your primary doctor to arrange something, either examined by somebody who is more experienced or to do simple tests like ultrasound. The second part of the testicle is called the epididymis, which is the connecting tube between the testicle and the spermatic cord. And these have different part, upper and lower part. You should not be aware about what's going on, but this is the second feeling that it should be also soft and usually goes to the lateral part, lateral posterior. And this should be smooth without having any abnormality in it. Sometimes tumor of the epididymis, this is another rare entity, which should be aware, or like beads in it, which should be raised the suspicion that what you have to take to do an ultrasound. The third part is the spermatic cord, the connection of the epididymis or the testicle with the retroperitoneal structures, which is through the vas going to the prostate area, and to do the semen will continue from that part of testicle to your ejaculation area. So this should be smooth, rounded, without having any other nodularity or any nodule or any hard masses in it. So these structures should be examined. The examination should not take more than 1 minute to each testicle. Evaluation, and by the end of the day, will be once monthly, simple test, and then he will be aware and be comfortable of what's going on in it. Thank you.
On a practical basis, is there a time of day that's better? Could you standing up, lying down, in the shower? Is there any, or it can be done at any time?
I think there is no definite part of time of day. It is just the best thing. The patient get exposed to anyone when he's having a bathroom or shower, and then the temperature will help that the testicle will go down, so that away from the body. In this case,
not too cold.
Not too cold.
Okay.
The testicles like that, the temperature, and that will keep all these sperms vital by coming to the body in the cold weather in order to get more temperature, while away from the body when we're having like high temperature. Okay. So having the shower is the best time, and this is a very simple test.
Great. We've had a message here. Again, messages can be completely anonymous if you prefer, and you want to get any concerns addressed by the expert in the studio. A message asking, 3 months back I had heavy pain in my testicles. The doctor diagnosed me with having infection down there and gave me 5 antibiotic injections, which cured me. Should I be worried about this cancer after this infection? Is there any connection?
So this is an infective type of process in the testicle. We call it orchitis. The orchitis is usually doesn't happen frequently or unnecessarily unless there's some source of infection. There's a viral, there's bacterial. The viral mumps usually may cause some infertility, but the bacterial unlikely. There is a granulomatous, which is like TB or sarcoidosis, that can become ended like a lump, which has been misdiagnosed as a tumor. So after your treatment, you should give it a rest of 4 weeks, and repeat ultrasound of testicle just to be sure there is no mass formation in that area that's been infected. Any mass formation, might be suspicious of either granulomatous problem, or it is somebody like another foreign body material or it is a tumor that need to be further evaluated. So the answer is you should not be worried, but you just need to be checked.
Okay, a message here, anonymous, saying, I recently had an ultrasound for a lump in my testicle. The doctor has confirmed its existence, but she stated it doesn't appear to be cancerous. What does this mean? What is this, and why do I need to go back for a follow-up?
That is a very common problem. This
Really?
is the most difficult part of the scenario. All the meetings we go and fight about it. Now, having the proportion and the shape of the mass in the ultrasound is the most difficult. Now, having vascularity, solid, irregular, or like front deformation, these are more characteristic of tumor. But sometimes, even with the best ultrasound and even MRI, testicle cannot confirm 100%. So in these scenarios, where we go, biopsy, excision of the lump, or taking the testicle, the most difficult answer is to take the testicle and there's no cancer, because now you really sacrifice it. So that what is happening here. You tell him just get another like 1 month repeat, go to the tumor marker just to be sure we are not missing anything else. And if there is no changes or it's minimal changes, observation is the answer. The question of biopsying of this, most of the data do not support biopsy of the testicle because of the implantation. However, these type of data has been loosened recently. We can do the biopsy, but still the standard of care not to do the biopsy.
Okay, I really hope that helps. We're joined this afternoon by Dr. Dima Abduljabbar. Yes, Dima?
Yes, sorry. I just want to add on, in this case, if there is a mass that need to be followed up, at that point, patient need to see a surgical oncologist, and to make sure they are aware, because most of the primary care or radiologists, there is like, it's always when it's benign features, it can be benign up to 70%, but we are missing 30% of cancer with these good radiology-looking masses.
One comment here. The standard of care in this country, because it's a metropolitan, and we don't want to point finger to anyone, the standard of care, there are different levels of radiologists, pathologists, and we work as a team to handle that part.
We're talking about testicular cancer for our first hour, and we're joined by experts in the studio. We've got Dr. Dima Abduljabbar. She is medical oncology consultant at the Advanced Care Oncology Centre in Dubai. Dr. Sadir Al-Wadi is here. He's the Director of Surgical Oncology Services at Al-Zahra Hospital. Question here saying, sometimes I have a light pain in my right side testicle. Is it just stress or strain, or should I be worried?
It is nothing you should not be worried. You should be a little bit concerned about it by proper evaluation. The simpler evaluation, let your primary care doctor evaluate you, and if need more, we can do an ultrasound plus some urine analysis plus simple blood test. If all negative, I think you are assured.
Okay.
And you just need follow-up.
Okay. I think that it keeps on coming back to this embarrassment factor of men not, first of all, and I say this with a great deal of love for my husband who's not listening, but he's generally reluctant to go to the doctors, and I think that's something that most men will identify with. He complained about wrenching his back yesterday. I was like, oh, here's some diclofenac, here's the blah, and he's like, no. I'm like, well, fine, I'm offering you help. You know where the doctors is. But I think men generally are a bit more reluctant. Question here from Sunil saying, I've been told there is a certain fruit available in Sri Lanka by the name of Katu Anuda, and from the Philippines by the name of soursop that can cure any form of cancer. Can the good doctors confirm this? Dr. Dima, what's your take on this magical fruit?
Well, we get this question all the time, almost 100%. If the patient from India, they will bring fruit from India. If the patient from Philippines, they will say something from Philippines. Really, there may be some investigational things about it, but there is no proof that this medication or these fruits can help. In fact, they may hurt the patient, because I had one of my patients who kept drinking lemon with bicarb or something, and his blood work kept getting crazy. And I told him, do you do anything? And he says no. And at the end of the day, I noticed that he's drinking lemon, so it can affect the way your body metabolize the drug we're giving you. So really, you should be very clear with your doctor if you're taking any medication or taking any herbal medication as well, or any even fruits, extra fruit. Like this patient, he was taking just lemon, like extra lemon with something else. So it's really important not to just play with your body with all these advertisement about all these cancer killer, because if there is such a thing, we will be the first one to
of course, and
keep it
someone
in
will be
my
making
office.
lots of money about it.
Yeah, exactly.
For a question saying, sorry to ask, but having limited or excess sexual activity, does it have any connection with testicular cancer?
There's no relationship between testicular cancer and any sexual activities.
There you go. A question here from, I think someone's also feeling a bit frustrated with their husband. Tamina saying, my husband has a lump in his left testicle and has been refusing to go to the doctor. He insists it's nothing and everything will be fine, although I feel it probably isn't anything too dangerous. I do get worried, especially after listening to you today. We have argued about it a few times and I've given up. How can I force him to get him checked out?
Let him come for a 3-second opinion and we will reassure him for you.
I think it's a first opinion.
No, his wife's the first opinion.
That is why.
But you can't force someone to go to the doctor.
Well, the test is very easy. It's just examination and ultrasound. No one is going to do anything. It's not painful. It's easy. So it should be, if we find it early as stage 1, we may not need anything else.
Yes,
no chemo or even just removal of that piece. I'm not sure what he has.
Which does bring me to treatment. So let's say it's detected very early on. Mm-hmm. It's stage 1. Mm-hmm. It's just in the testicle. It hasn't spread to anywhere else. What kind of treatment would a patient be looking at?
So it depends on the type of the tumor as well and the risk stratification, as we said before. So seminoma versus non-seminoma versus other type. There is also a lymphoma or something. So you could have just removed the testicle. You could have had some radiation or even maybe single chemotherapy, but it will be much easier than treating a patient with stage 3 or 2, and it will be also the chances of cure is much higher when you discover this very early. So that is our goal, is to find it very early where you don't need any treatment and you don't need us to get involved. So that's why we are here today. So we really don't want to treat these patients.
One thing I think we did not really discuss a lot about the tumor marker of the testicular tumor. There is really a very good colon cancers and liver tumor. There's multiple markers that we can observe them and follow the patient with the testicular tumor. Plus, we can confirm our diagnosis. So this is a simple blood test, which is insurance approved, and we can do it part of his workup.
Okay, I hope that reassures you and your husband. Now, in terms of side effects, a question here that I think may be playing on a lot of minds, anonymous questions that's come in, saying, my husband is a testicular cancer survivor and has been clear for 7 years. Everything is fine, but we've been trying for children for 9 months and I'm yet to get pregnant. Is it possible that he might not be able to have children? So what kind of effect does treatment have on fertility, doctor?
So first of all, patient with testicular cancer was found to have problem with fertility 50% at the time, even before started treatment. For some reason, no one knows why is that, but they do have some issues with fertility. Now, when we get to the treatment part, it depends on, of course, again, whether we're going to get chemotherapy or not getting chemotherapy, but whenever, even with other tumor, when we give chemotherapy, patient wants still to have kids, we always first of all send them to a fertility specialist and recommend cryopreservation, which means just store the semen at colder weather. Usually there is a lot of way to do that to help them. So I'm not sure if he had chemotherapy in the past or not.
Doesn't say, unfortunately.
Yeah. So that will be a big part, but he can always go and check himself and see if they can have kids again, so they don't keep trying with that.
Have a bit of a screening. Question here saying, I'm 54, I have a soft mass on left testicle. Main ball is there normal, no pain, but I've had this for 40 years. It was never a concern during my yearly checkup. What is it? So it's a soft mass on one of his testicles.
Anything can be in the soft mass on the testicle. Could be just lipomatous tissue. If it's in the testicle or in the scrotum, that is the sometimes differentiation between the two different parts. So having an ultrasound yearly and just simple evaluation of it, that will be more than enough.
Okay, and last question, doctors. Anonymous message saying, hi, I've been having this situation for 20 years or so. Every 3 or so months, in the middle of the night, I have stabbing pain in my testicles, maybe prostate area, which can last for 10 or 15 minutes. There's no lump in them, it's just uncomfortable. I've learnt to live with it. Is there anything I should be worried about?
Having a pain in the testicle and disappear in 15 minutes, there's nothing to do with the prostate. Usually it's the testicle or epididymis of the testicle, which is a small that by get partial torsion and coming back, or any engorgement of the epididymis or the testicle. I don't think so. There's something serious for having 20 years. Simple ultrasound, just to keep your mind clear, that will be enough for it.
Why would it happen in the middle of the night?
Usually multiple reasons. Positioning and the epididymis positioning, that untorsion, partial untorsion, that could be the reason of it. Gravity and non-gravity effect, plus near to by the body or away from the body.
Okay, I hope that helps. Doctors, thank you so much for joining us. We've had Dr. Sadia Al-Wadi and Dr. Dima Abduljabbar joining us in the studio this afternoon. Really, really appreciate your insights, and hopefully we've raised some awareness for gentlemen of Dubai. Have a great afternoon, guys. Thank you.
Thank you.
There's just so much more to hear.
Download our podcasts at DubaiEye1038.com.